Hi, John Rothery, Osteopath. I've been asked to produce a video about muscle sprains. So often in footballers, what they tend to do is have a ligamentous sprain on the inside of the knee. Just a bit of anatomy. This is called the medial collateral ligament, and it connects the femur to the tibia, which is one of the most commonly sprained ligaments in football. On the outside here, you've got the collateral ligament or lateral collateral ligament, and then you've got the meniscus, which are these shaped cartilages here, and then you've got the ACL, which people talk about rupturing, which stops the tibia from pushing forward over the femur, and then you've got the posterior cruciate ligament. So one of the ways we can assess it, if it's a grade 1 tear, I'm going to talk you through it. So as we look at the knee, we're going to put a little dot here. That's what we call the superior pole of the kneecap or patella. This is the inferior, this is the medial, and this is the lateral pole. And what we tend to do is just off the medial pole, about 2-3 centimeters, you can feel the ligament. So we're just going to draw on here so I can show you what it looks like. There's a superficial and a deep portion of this medial collateral ligament. But what the player tends to do is they tend to, they slip or they hyperextend their knee. So they hyperextend and what's called a valgus movement. So they hyperextend and do this kind of movement. So what we do to test it, we do a valgus movement with the leg straight. So we push and pull. But actually, the best way of doing it is putting it about 30 degrees. And as we take this foot out, you can see how the ligaments gap. So if it's a grade 1, you're looking at very little movement here, maybe up to 5 mil. If it's a grade 2 tear or partial tear, you'll maybe see that it'll move 5 to 10 mil. And if it's a grade 3 or a rupture, it's 10 to 15 mil. But most of the patients tend to find they get pain here on the inside. Often, if it's a grade 3, they won't be able to fully extend their knee. It'll be held in this position. There'll be pain and swelling here and pain around here. So grade 1, very minimal gapping. Grade 2, 5 to 10 mil. And then if it's a grade 3, you're looking at 10 plus. What we do is take the knee into flexion. So we put our fingers onto the medial border of the femur and lateral border, and we flex. They'll normally find if it's a grade 3, there'll be pain. They won't be able to have that movement. And then what we do is we take it into slight valgus, and you might feel, if it's a grade 3 tear, what will happen is it will be a kind of a boggy, empty end feel, but we're looking for a firm ligamentous end feel. We then test the ACL ligament, so we sit, hands behind the back of the tibia and pull and see what that's like, and if there's any emptiness or looseness, and push for posterior cruciate. And for lateral collateral ligament, this one down the outside, we just let the leg go from it, external rotate and see if there's any end feel pain there as well. So generally, pain around the inside, medial collateral ligament sprain. Okay, cool. Hi, John Rothery, Osteopath. So we're going to show you some treatment modalities now for what we call a medial collateral ligament sprain. Remember we talked about the 3 grades. Grade 1, minimal disruption to the fibres. Grade 2, we're looking at 5 to 10 mil of gapping. And a grade 3 might need surgical intervention. But this, let's say this is a grade 1. What you do is you, again, remember, go off the medial pole of the patella and just drop off. And you tend to feel this slight pain in here with the patient. And so we use acupuncture. The reason we use acupuncture is it's poor blood supply to the ligaments. They're avascular. So what we'll do is stimulate the blood supply to the area, microcirculation, and it helps with the pain modulation at a local level into this area. So I tend to put quite a few needles into the medial collateral ligament here. Okay. And we'll leave them in for maybe 10 to 15 minutes just to get some new blood to the area. And then probably one more. So we're looking at the superficial and deep fibres of the medial collateral ligament here. And we'll just leave them there for a few minutes. You could use ultrasound. Ultrasound work really well. There's some good evidence for ultrasound. You could use a Graston tool, the one I showed you before, really lightly around this area. But this is probably the initial stages of the inflammation. So you're trying to get new blood to the area, help with the pain modulation. This is what I would do personally. Okay, cool. So I'm going to show you some taping techniques for what's called a medial collateral ligament sprain. You can see where the ligament is. So you might see taping in the football club. It just gives structural support to the player, gives them a bit of confidence, improves that proprioception of the knee. So what I tend to do is, you get an ice strip, again peel off the ends here, and what we're going to do is, on the medial side of the femur, we're going to lay it on with no stretch, and all we're going to do is just feed it around this area here. We're going to heat activate it. Okay, and then what we're going to do is get 2 small ice strips, and what we're going to do is we're going to put the tape on about 60% of stretch in a cross fashion just to support that medial collateral ligament. So again, we peel them off, we pull the tape back, lay them on that where the X marks a spot. So that's the first one with about 60% of stretch. Heat activate the glue. Again, same again with the second small ice strip, peel it in half. Try not to get your hands on the tape. Again, we're going to put it in a cross and lay it on down. So there we've taped for what's called a medial collateral ligament sprain, a grade 1 or 2. So we've taped the knee, we've done some acupuncture as part of treatment, but what we're going to do, obviously, as we progress through the healing process, we're going to do some strengthening exercises, and the quicker we do the strengthening exercises, the better. He's not ready for weight bearing yet, but we can still do some exercises as he's lying on the bed. Often when a patient presents with a medial collateral ligament, a footballer, you tend to find the knee is slightly flexed. So one of the exercises we get the patient to do is just straighten the leg slightly and push down gently. This is in the inflammatory stage, and again for me. And we just try and push down. One of the things we can do later on to strengthen this area, the whole complex, is an isometric stretch. Sorry, isometric strengthening. So if you bend this knee for me, and just take the leg up slowly, Matthew, and then hold it for 5 seconds there. 1, 2, 3, 4, 5, and drop down, but don't touch the bed, and then bring it up again. Hold it for 5 seconds and squeeze. So this is an exercise we can do to strengthen the whole musculature of the area. And then you progress on to doing, you can relax now, doing weight exercises in the gym, and then you start jogging, and then we start pool jogging, and then do some zigzag movements, and then obviously incorporate that into the football progression for rehab. Thank you.